Welcome to the Vet Dental Show. I'm Brett Beckman, board certified veterinary dentist, and we bring this podcast to you every Wednesday as a veterinarian, as a technician, as a dentistry team to help you be even better at veterinary dentistry in your practice. We're sponsored and partnered today with the Veterinary Dental Practitioner Program. If you're interested in being among the best anywhere in general practice as a team in veterinary dentistry, I invite you to request an invitation. Just go to ivdi.org/INV, like invitation, first three letters INV. So IVDI, International Veterinary Dentistry Institute, ivdi.org/INV, and we'll get you the information that you need.
Today we have a special guest on the podcast, Dr. Brett Beckman, and Dr. Beckman is a dental specialist, and we talk about all kinds of really cool things as far as how the standard of care works and what kind of opportunities there are in marketing as it relates to dentistry. And we also jump into a bunch of stuff because Dr. Beckman is an amazing marketer and has a really, really good digital presence online. So we talk about a lot of stuff that's very, very beneficial for everybody listening. And so be sure to listen to the whole podcast episode because it's definitely going to have a bunch of value for you in your practice. So it's a great episode. I really, really enjoyed it. Here's my interview with Dr. Brett Beckman. So, all right. Thank you so much, Dr. Beckman, for joining us today. Dr. Beckman is the founder of veterinaryDentistry.net. And so, Dr. Beckman, can you please introduce yourself? Thank you so much for being on the podcast today.
Oh, thanks, Brandon. Thanks for having me. I'm Brett Beckman. I'm a board-certified veterinary dentist, and I practice in Atlanta part-time, just north of the city in Sandy Springs, Georgia, and I'm also in Orlando, Florida. And I have a wonderful full-time veterinary dental technician that helps me, Annie Mills, who I pretty much can't function without. So great to have a team, which we'll talk about a little later, the veterinarian and technician team in the dentistry service.
Very cool. And can you tell us a little bit about what veterinaryDentistry.net is? Because as an outsider from the industry, I'm not a veterinarian or anything. I pretty much thought that most veterinarians did dental work, but that sounds like it's not the case, at least to the same extent that you teach it. So what is veterinaryDentistry.net?
Sure, Brandon. VeterinaryDentistry.net is a website that we started years ago, and it's evolved quite a bit over time, and now it's actually the basis for our 42 hours of online courses that we have available that can be read. You can register for those, and you have access 24/7 to those. And also is kind of a calendar of sorts for our live courses. We do 14 to 16 cities on Sundays around the country and in Canada each year, and then I have 2 courses in the spring, 2 courses in the fall, where we actually do extractions for a weekend. One's for canine and one's for feline.
Very cool.
And all those are on the website. And so that website now provides that basically the outlet for the calendar and the portal for registration for those.
Very cool. So what do most practices do today as far as dentistry goes?
Dentistry, for the most part, hasn't changed a lot for the majority of practices, unfortunately, over time. Even though the technology's gotten a lot greater and more specific for being able to affordably provide what we'll call the standard of care in veterinary medicine, and I'll describe in a minute, the general practitioners are still, unfortunately, cleaning teeth and then extracting mobile teeth that are grossly mobile and unfortunately not doing much in between. And the reason being is because the technology to provide that in between is full mouth dental radiographs, and there's still a large number of practices around the country, around the world, that don't have that, and that's the basis for the standard of care that I'm referring to. So you have that level of practice that hasn't really stepped up to the opportunities that are available to them, and it's unfortunate because the patient is ultimately the one that suffers. And the progression to the standard of care practice is taking whatever little that we've learned in veterinary school, and unfortunately that's still a big issue as well. Veterinary dentistry is not even part of the curriculum for the majority of veterinary schools in this country and around the world. So you take that aspect, and you have a practitioner who may have had a little bit of exposure, and put them into the real world and put them in a practice that's practicing the clean and jerk, as we call it, to reference the bodybuilding or the weightlifting term, where they clean teeth and they pull the ones that are mobile and everything else gets left by the wayside, to the standard of care practice where you have a veterinarian and a technician dentistry team within that service, or maybe two technicians, or maybe two dentistry technicians and an anesthesia technician, and that group, whether it's 2 or 3 or 4 people, provide full mouth dental radiographs on all patients, and the veterinarian can quickly and efficiently assess those radiographs, make treatment decisions immediately, and then proceed on with the therapy. And obviously when we're looking at that model of clean and jerk, if you will, and then we're looking at the model of standard of care, the time difference in procedure is tremendous. Once we get to the standard of care, there's no such thing as a 30-minute prophylaxis or 30-minute cleaning. Our procedures now become 90 minutes, 2 hours, maybe 2.5 hours, so that step between induction and actually doing the treatment from the veterinary side, doing mainly what it involves is doing surgical extractions when you get down to it, has to be minimized in order for that extraction procedure, periodontal procedure, to be able to be facilitated in a time period that's consistent with keeping the patient safe. And we're dealing with small patients for the most part. We're dealing with cats, which have a lot of tooth resorption and periodontal disease starting fairly young for the most part. And we're also dealing with small dogs, is the other big category of patients that have periodontal disease. So that is the patient that's on the table in the general practice, the dog or the cat that has periodontal disease and or tooth resorption.
Gotcha. And so how does somebody incorporate that into practice? And what are the steps to do that?
There's a lot of ways that you can do it. You can do it from the traditional sense, and that is by books, go to conferences, get your training piecemeal, and that's very difficult. It's very time-consuming. There's a lot of decisions that have to be made on the part of the practitioner as to where to get those resources and how to proceed through the resources that they have. And as we've evolved, we're now in veterinary dentistry, we've gone from that to having the availability of courses that are taught online that provide the knowledge portion of the acquisition that needs to happen prior to the practical portion, which is basically extraction wet labs that finalize that whole training process. So the recommendation that we have and that we have available now is for the learning to come about through online courses that actually show cases. You take the practitioner through, okay, this is what the patient looked like, here's the image, and then here's the x-ray associated with that image, what do you do? And walk them through that learning process to the point where they see it like they would see the case actually in their practice. And so that multiple facet learning process, that being able to see it, hear it, and experience it is much better than reading a book and trying to piecemeal lectures that they've seen over several years in order to get that to culminate into a good experience that they can actually put into practice. The other great thing about having for instance, our courses that we have, that's kind of a one-stop shop. You've got everything there. You've got all the learning through the videos and the lectures format that can be revisited time after time again, and then you've also got the access to our wet labs that we provide, and we're not the only ones that do that. There are multiple teaching centers around the country. There's Dr. Luskin out in Baltimore and Dr. Woodward in Colorado, Dr. Nemec in California. We're in Orlando, so there are multiple places where you can get that type of training. So depending on your geographic area, you might choose one of those as well. But for the general practitioner, there's nothing that's quicker, there's nothing that's more streamlined than to be able to have a group of courses that you can go back to and you can review and you can watch and learn from a case standpoint.
Very cool. That makes a lot of sense. One of my favorite books is called You Can't Learn How to Ride a Bike at a Seminar. It talks specifically about that, and actually all of those things that you talk about really, I'm sure, help to cement and teach everything that they need to know. Can you talk a little bit about the Pareto principle? When we're talking about high-end services, I use the Pareto principle all the time in marketing, so I'm interested to see what you use it in respect to the high-end services that practices can offer in practice.
Excellent. Well, I've heard you mention that before in your podcast, and it's something that we've taught for quite some time, and it goes back to the old veterinary economics magazines, and you couldn't literally open up one of those and not see something about the Pareto principle or the 80-20 principle, where 80% of the revenue from the practice is derived from 20% of the clients. And that 20% of the clients are the ones that are also can be classified and have been classified as your A clients. They're the ones that if you tell them to meet you at midnight on New Year's Eve for a dental procedure for their pet, they're going to be there, and they'll be there early. So that is your best client base in the practice, and we have to step back and look at that, not only just in conjunction with dentistry, but in conjunction with how we approach practice in general. And this is kind of getting into the general practice theory a little bit, but we can't please everyone. So would we rather please the 80% that are responsible for 20% of the income and probably 80% of the frustration and the client problems, or would we rather up our game and cater to the 20% that is responsible for 80% of the revenue and really increase our services to those clients to match their expectations? And as we travel through this era of technology, and it's just exponential now of what we can do, we find that clients are more knowledgeable, they are demanding more, and we see it in specialty practice, and unfortunately to the detriment of the general practitioner, where a cleaning may have been done several months prior and there's still an odor, and the client goes back to the general practice, and for one reason or another, multiple reasons, we get them on referral, and we, unlike the general practice, take full mouth radiographs, and we find all this pathology under the gum, and we end up doing 6, 8, 15 extractions where this patient had a cleaning and was sent home good to go several months prior. So it's kind of a difficult situation that we deal with, and we try to avert problems when we see that, but it's becoming more common, and we see it quite a bit as a dentistry specialist, and it's going to be a problem, unfortunately, for the general practitioner going forward, where they're going to have to deal with clients that are not happy because they didn't provide that level of service. So it's kind of a wake-up call for us, and dentistry is one of the things that we can do in general practice that really cements the bond with the client, because every single one of those patients that comes in that's a small breed dog that's 6, 8 years of age and has the oral odor and the calculus and the gingivitis and the gum recession, every single one of those dogs need full mouth dental radiography, and every single one of them will have anywhere from a couple to 15, 20 or more extractions. And if it's done correctly, if we go in and we do surgical exposure of that tissue, we not only remove the teeth, but we also clean all that tissue up, we contour the bone, make sure that there's no disease left, and then suture back the gingiva. Then when that patient comes back for a recheck, that owner is so appreciative, because they can detect any one of a number of positive behavioral changes that have happened since the patient is recovered versus prior to the procedure. So those clients become even more enamored to your practice, because they've seen the benefits of what one procedure can do for their pet. And this is not the exception either, Brandon. This is the rule in general practice. If a practice is practicing at that level, they're practicing at a level close to what we do as specialists from a periodontal standpoint. They can learn how to do extractions just like we do extractions, and there are many practices around the country and around the world that are at that level, that provide the full mouth dental radiographs and provide the surgical extractions and have that same experience with every client that comes back for the recheck. And so they know. And the ones that are in your audience, I'm sure there's some there. They're probably shaking their heads yes now, because they realize that, yeah, that's what happens every time.
Definitely. Well, that makes a lot of sense. I mean, people don't go to the dentist and the only choices are clean it or extract it, and, without any other checkup. So as far as client education, I think that's really where the marketing comes in, and teaching clients that it's just so many opportunities for practice, especially if you specialize in this.
I hope you enjoyed that episode. If you'd like more information about the Veterinary Dental Practitioners Program, please submit to request an invitation at ivdi.org/INV.